I'm Dr. Christoforou, naturopathic doctor at North Coast Family Health. Today's health tip is all about natural ways to ease aches and pains. Let's begin by first defining what is pain. Pain is your brain registering that there's some kind of tissue damage going on in the body. The tissue damage releases inflammatory and nociceptive molecules, which in turn stimulate nerve fibers that take the signal up to your brain. Pain is always just a symptom, and there's always an underlying cause, and it's important to look at these underlying causes when we're looking at treating pain. One of the underlying causes, pain could be due to mechanical issues or overuse injuries, so think strains and sprains and dislocations. It could also be due to structural issues, so maybe a subluxation where the bone goes out of place and then impinges a nerve that creates pain. And lastly, pain can be due to underlying systemic diseases, cancer, Lyme disease, rheumatoid arthritis, fibromyalgia, and many others. So when we're looking at pain, again, it's important to look at these causes, but in the meantime, there's a lot you can do naturally to ease aches and pains. There's both internal things and external things we can do. So let's take a look at the internal first. Under the internal category, botanicals are wonderful tools in your toolkit to have to ease aches and pains. Again, we talked about pain being an inflammatory process, so any botanical that's anti-inflammatory will also help pain. Turmeric is at the top of this list. Turmeric contains a powerful plant compound called curcumin that really inhibits pro-inflammatory pathways and also depletes substance P. Substance P is a major neurotransmitter in the pain signaling process. Ginger is a related botanical that's also very anti-inflammatory, analgesic, and it also is really good for spasmodic types of pains. Then we have frankincense. Frankincense is also very good anti-inflammatory, analgesic, and it's really specific for rheumatic conditions. So think your rheumatoid arthritis, osteoarthritis, and it's coupled very well with an herb called devil's claw, which has much of the same actions. The last botanical I want to highlight is white willow bark. White willow bark is, again, a good anti-inflammatory analgesic, and it contains this compound called salicin, which is converted to salicylic acid, which is the active compound in aspirin, so it acts in much of a similar way. In addition to botanicals, proteolytic enzymes can be wonderful adjuncts for easing aches and pains. Enzymes like bromelain, papain, chymotrypsin, and trypsin digest these inflammatory proteins that are circulating around, causing inflammation and then causing pain. Magnesium is also wonderful, especially the malate form that has an affinity for muscle tissue. So supplementing with magnesium malate could be a wonderful adjunct to bring on if your aches and pains are more muscular in nature. Next is the external category. So at the top of this list are topical things we can do and apply directly to our skin to get immediate pain relief. So at the top of this list is capsaicin, which is the active compound in cayenne. Capsaicin also depletes substance P, that neurotransmitter that's involved in pain signaling, and can be a very effective topical agent for pain. Menthol is also a wonderful topical agent. This is the active component found in a lot of mint plants, so peppermint and spearmint. And when applied topically, it has a cooling effect, and this cooling effect is what helps it relieve pain. Camphor is another compound that's really wonderful, and it acts in much of the similar ways where it reduces inflammation, reduces pain. And lastly, there's CBD. So CBD is a compound from the cannabis plant. It can be taken internally and externally, and it has much of the same effects both internally and externally. It's immune modulating, it's anti-inflammatory, and relieves pain. So it's nice to supplement again internally and also use different balms and salves that have CBD externally. In addition to topicals, there's different physiotherapy techniques that are wonderful adjuncts for easing aches and pains. The top of this list is TENS, stands for transcutaneous electrical nerve stimulation. This involves using low voltage electrical stimulation that directly blocks these pain signals from ascending from the tissues up to the brain. Next we have low level laser therapy. So this is using cold laser for its photodynamic effects, not for its heating effects. The light directly penetrates skin and soft tissues and even hard tissues. It can get deep into the joints and stimulate mitochondria, accelerate tissue healing, and directly reduce pain levels. And then the last physiotherapy technique we have is therapeutic ultrasound. Ultrasound is the use of sound waves for both of its mechanical and thermal effects. And both of these, the end result is deep tissue healing, stimulating wound healing, and easing aches and pains. Exercise is also a wonderful thing to do to ease aches and pains. So when you exercise, you release endorphins, and these endorphins directly counteract a lot of these nociceptive molecules that are released when we're in pain. Next, castor oil. So castor oil applied topically is a wonderful anti-inflammatory, and when coupled with heat, that heat can help drive some of that oil deeper into tissues, and it could be a wonderful local treatment for whatever area of your body you have an ache or pain. Next are things like hydrotherapy. So hydrotherapy is the therapeutic use of water. This could be something like an Epsom salts bath. Using warm water in the bath and then adding some salt. The warm water is going to help with circulation, vasodilation, and the salts are really going to help kind of penetrate the tissues and getting some of that muscle relaxation effect because of the magnesium in the salts. You can also do something called contrast hydrotherapy. So contrast hydrotherapy involves using water in the two temperature extremes, so hot and cold applications. The hot, again, opens up your blood vessels. It brings blood flow to areas, so bringing oxygen and nutrients to tissues and also carrying away toxic waste and carrying away some of these inflammatory nociceptive molecules. The cold is a nice contrast because it reduces inflammation and it reduces swelling. So doing some kind of contrast hydrotherapy where you're doing 3 minutes of hot application followed by 30 seconds of cold. Repeat that for about 3 times, and doing it as often as you can throughout the day might be a really nice, easy at-home thing you can do to ease aches and pains. And then lastly, things like soft tissue massage and acupuncture can be wonderful things to include in your care plan when you're looking at treating pain naturally. I hope this video was helpful. I highly encourage you to call the clinic for a free 10-minute consultation with me. Again, we talked about how pain, it's very prevalent and there's always an underlying cause. We always want to look at that first and come up with a specific individualized treatment plan for you. Thank you. Talk to you soon.